Hi, I wanted to thank you for coming to my town hall presentation of diabetes in Nebraska. So first, we'll define the issue. Diabetes is a chronic disease that involves high levels of sugar in the blood. So there are three different types: type 1, type 2, and gestational. Type 1 is insulin dependent, and type 2 is non-insulin dependent and usually develops in adulthood. And gestational develops during pregnancy. The cause of diabetes depends on the type, and it depends person to person. So type 1 can be caused by environmental factors or genetics. So if a person's parents or siblings have it, then that person's most likely to get it. Type 2 can be caused by having prediabetes and also unhealthy lifestyles. So not exercising, poor diet, being overweight, things like that. Gestational diabetes can be caused by obesity during pregnancy, having another type of diabetes during pregnancy, or your pancreas not able to keep up with the amount of insulin that it needs to produce. So in the past 20 years, diabetes overall in Nebraska and across the US has become more and more common, and more people are being diagnosed with it. There are different risk factors that impact diabetes. There is modifiable and there's also non-modifiable. So the non-modifiable ones are the ones that you cannot change. So like we talked about, genetics. You can't help who your parents are or what health issues they have. Your age. As a person grows older, they're more likely to have less muscle mass, have greater fat, and do less activity. So they're more likely to develop type 2. Race is also a risk factor. So African Americans, American Indians, and Asian Americans are more likely than whites to have diabetes. And gender. So being male puts you at a greater risk than female, because males tend to carry their fatty tissue in their abdomen area, so that puts them at greater risk. The two modifiable risk factors are physical activity and diet. So if a person isn't very physically active, they sit at a desk all day and are very sedentary in their job, they're more likely to develop diabetes. The same goes with diet. If you don't know how to cook like fruits and vegetables and lean meats, and you maybe eat out a lot or get fast food through the drive-thru a lot, you're more likely to develop diabetes. So the scope of it, it's considered an American epidemic. There are 34 million people across the US that are currently diagnosed with diabetes. In Nebraska, 8.8% of adults have diabetes. So diabetes can be impacted by a person's socioeconomic status and their education level. So the cost of the disease is super high. You need insulin, you need supplies to administer the insulin, you need test strips, you need a glucometer to test your blood, things like that. So people that are low income are more likely to, first of all, not have the money to purchase the supplies. So then they're not treating their diabetes and they can get sicker and sicker. They may not be able to afford to go to the doctor, so they're not keeping their regular appointments and having regular checkups with their doctor. Or if they don't have diabetes yet, they may just not be going to the doctor at all. So if they're not having those regular checkups that check your glucose and your cholesterol and all those things, and you get your BMI and you get your blood pressure checked, all those things, they may not know they may be at risk for diabetes. And so that can lead to more problems down the road. Your education level is impacted because if a person doesn't have a college degree or doesn't have, a high school diploma, they may not know how to eat healthy or how to cook healthy, or they may not know how much exercise they need in a day. So the lower your education level is, the higher risk you have of developing diabetes. And then for demographics for this, like I said, 8.8% of adults in Nebraska have diabetes, and they estimated that over 44,000 people have undiagnosed diabetes in Nebraska. So again, this could be the people that are low income and aren't able to go to the doctor. Maybe they don't have health insurance and they can't afford to go to the doctor and pay out of pocket. Or maybe they haven't had their blood sugar checked in a while and don't know they have it. So that's really a scary number, because if people aren't managing their diabetes correctly, it can really lead to more illness down the road and a lesser life expectancy. So in Nebraska, 9.1% of males have diabetes and 8.3% of females. So like I mentioned earlier, males are more likely to have diabetes. And in Nebraska, it's more likely for those older adults, 65 plus, to have diabetes rather than that 18 to 64-year-old age range. And then for race, 15.8% of American Indians and 13.7% of African Americans have diabetes. And then Hispanic is next at 12.7% of their population. A few laws and policies that impact diabetes in Nebraska or across the country. So the first one I found was Eliminating Disparities in Diabetes Prevention, Access, and Care Act. So this was a bill that they were trying to sign into Congress that talked about increasing the research on the causes and effects of diabetes in those minority communities. Like I spoke about earlier, African American, Asian American, and American Indians are more likely to have diabetes than, say, Caucasians. So research needs to be done to determine why that's happening and how diabetes impacts their body. And then also it talks about the effective treatment, prevention, and public education for those minority communities. So if they could enact a policy where they would have proper classes or education seminars to help with that prevention, then it could help not have so many people get diagnosed later down the road. Next is the Protecting Access to Diabetes Supplies Act. So this is an act where Medicare recipients who have diabetes would have access to the testing supplies that they want. They're not limited to this generic off-brand. They can get, the brand name test supplies if that's what they want. It also eliminates suppliers from making changes and only allowing them to buy certain things. So that's helpful to make sure they're getting the supplies that work best for them and for their life. A couple programs within Omaha that I found are the Diabetes Prevention Program by the Douglas County Health Department and Living Well with Diabetes by the CDC. So the Diabetes Prevention Program in Omaha is a year-long program. So the first 16 weeks, the group meets weekly, and then they meet monthly after that. They talked about how to control their health, so what to eat, how to exercise, and then they also have just a support group. So people living with diabetes can get together and share their feelings and talk about what works for them so they can have, live a happier life and a more controlled diabetic life. The Living Well with Diabetes is a campaign for people that already have diabetes. And their kind of mantra, their mission is eat well, be active, and manage stress. They say that if you do these three things, then you can live a happy, healthy life with diabetes. And then two community groups in Omaha that I found. So One World has a couple different classes. So they do a Dominate Diabetes class, which for people that are already diagnosed. They do a diabetes prevention class, which, like it says, is for prevention, so people that don't have it yet. And then they also have a free food pantry, which I think is a really great program to have because people that are low income that can't go buy those fresh fruits and vegetables can go to this food pantry and get those healthy foods. And then finally, the Wellbeing Partners in Omaha have developed a program where their mission is to build well-being into communities. So they do that through programming in different businesses and community organizations. And then to compare diabetes in Nebraska to other countries, I chose Mexico City and China. So Mexico City did a project that was on health promotion and awareness. So they did this in schools, and it was meant to prevent future diabetes. So they had education sessions for parents and teachers and administrators for how to have more physical activity with these kids and how to encourage healthy lifestyle. And then that way those kids, are developing healthy habits and potentially not having diabetes later in life. And it had a really great impact and it reached a lot of children. And then in China, I kind of went the different route and I looked for something a little different. So they did their study on complementary and alternative medicine. So they had an herbal supplement that's called Yuquan Wan. And it's a supplement that's taken to help regulate the blood sugar, and it helps make the diabetes symptoms less severe. So again, it's not FDA approved, so it probably wouldn't get, passed in the US, but in China, it did have a good impact on this small study group and really helped them lower their diabetes symptoms and their blood sugar. And then finally, I'm going to end with my 2 solutions to help impact this problem of diabetes in Nebraska. So my first solution is to develop a worksite wellness program. So this program could be incorporated into any business, any corporation, organization that has employees and wants them to be healthier. So it could be points based. So the participants would do certain activities, challenges that I'll talk about, and they could earn certain points to win prizes, maybe like a PTO day or like a gift card to like Eat Fit Go or like Whole Foods, things like that. So there would be challenges, posters and handouts, and webinars. So the challenges could be like a 10,000 step a day challenge. So every day that a person gets 10,000 steps, maybe they get 5 points. And then, you do that for a month, and whoever has the most points might win a prize. Or you could do like a water challenge. So you could encourage people to drink, 64 ounces of water a day. And then if they complete that, then they get a couple points, things like that. Posters and handouts can be helpful. You could put a poster next to the elevator saying, take the stairs for a healthier heart. Or you could, and if they have like a cafeteria or like a break room, you could put out a bowl of fruit and say, take a piece of fruit instead of going to the vending machine and getting a bag of chips, things like that. And then webinars. So this could be different people from the community, or maybe someone at the company is, invested in wellness and has like a degree or training in that. And you could talk about like healthy lunches or healthy activities, or, how to be active at work. So just bringing in different people to help combat, help prevent diabetes, but then also help combat like obesity or overweight in that work population. And then my second solution was more aimed at children and preventing children. So I came up with an idea for children that are at risk. So this could be children that are born to parents that have diabetes, or maybe children that are, large for gestational age and could be at risk later in life. So this would be regular screenings every year. So I know kids go to the doctor a lot, in their first couple of years of life. So just doing like a simple finger stick for their blood sugar and their A1C values, and then being able to educate parents and the children, if they're old enough, about how they can help prevent diabetes. I think regular screenings like this could really help lower the amount of children that do end up with type 2 diabetes later on in life. And the education could be on activity and diet and different other interventions they could do to help decrease that risk. And then if a child is at risk, or they do have, those early signs of developing diabetes, these doctors could implement these early interventions to help stop that or combat it so that it doesn't get worse down the road. And then here are the references that I used. And that is all. Thank you for coming.